It starts as any other day, only today there's a global pandemic. You are sick and tired of staying home and decide to go to a friend's house for a cookout. You stop at the local Walmart for chips and beer. A few days later, you develop a cough. Then you realize you have a fever. Eventually, it gets hard to breathe and you end up in the emergency room where they test you for the coronavirus and admit you. Your organs start to shut down and your body starts to die. Your family and friends can't visit. They can't tell you goodbye. You lay there, you die in a hospital bed alone as your organs fail and you die. Never in our history has a virus caused a ripple effect like this one. At first, people didn't take it seriously. Unfortunately, that is part of the reason we are in the mess we are now. Perhaps you were thinking this is all just a bunch of baloney and we are overreacting. I will tell you right now, we aren't. Now you're thinking, oh great, another person who thinks they're an expert on the coronavirus. I will be honest, I'm not an expert, but I do work in healthcare at a long-term care facility. Our residents are highly susceptible to this virus. Our job is to keep it out of our building and keep our residents safe. Our information doesn't come from nightly news or Facebook. We get our information and guidance from the state and federal level. I'm going to share the knowledge that I've been given and help you realize the severity of the situation. First, I will explain what the heck the coronavirus is. Then, I will cover 3 main points. 1, safer at home orders. 2, essential travel. And 3, why this virus is dangerous to everyone. Believe it or not, coronavirus has been around for centuries. A coronavirus is simply a virus that infects animals and mutates and evolves and spreads to humans. Once it infects the humans, it is considered a human coronavirus. This new coronavirus disease is also referred to as COVID-19. CO for corona, VI for virus, D for disease, and 19 for the year was discovered, 2019. There are a lot of theories of how the virus started, but none of them have been confirmed. The CDC believes that there's a high probability that the virus came from a bat, but they also feel that the bat contracted it from a different animal or even gave it to a different animal, and then that animal was consumed by a human. The uncertainty surrounding COVID-19's origin makes it hard to learn and treat the virus. We do know that it started in Hunan Market in Wuhan, China. On March 24th, to slow the spread of COVID-19, Governor Evers put in effect the safer at home orders. Then on April 17th, those orders were extended to May 26th. As hard as it is, we all need to stay home as much as possible. COVID-19 is a respiratory infection that can cause pneumonia in both lungs, multi-organ failure, and in some cases, death. It spreads through droplets in the air when an infected person coughs, sneezes, or even speaks. It can also be contracted when someone touches an infected surface, then touches their mouth, eyes, or nose. The incubation period for COVID-19 is 2 to 14 days. Think of how many people you come in contact with between 2 and 14 days' time. You could have potentially infected all of those people, and then they could have went and infected all the people that they've come in contact with in 14 days, and that vicious cycle continues. It doesn't mean you can't ever leave your house again. What it means is that individuals in the state of Wisconsin are ordered to stay home or at their place of residence with limited exemptions. Individuals who are using shared outdoor spaces other than their home or residence must at all times, to the extent possible, maintain social distancing of at least 6 feet from another person. Individuals do not need to maintain social distancing between family members in a single living unit or with other household members. All individuals may leave their home or residence for a number of essential activities or functions. These orders are to help reduce the curve. The less you leave your house, the less chance you are of becoming exposed or of exposing others. Safer at Home is working. Wisconsin was expected to have 22,000 cases and between 440 to 1,500 deaths by April 15th. Currently, we're at 4,845 cases and 246 deaths. Now you're probably thinking, well, what the heck do you guys consider essential travel? Essential travel includes traveling for work, health, and safety, such as picking up medication, visits with health care providers, obtaining groceries and food, buying gas or pet food, other activities necessary for maintaining a home or residence. It also includes outdoor activities such as walking, biking, hiking, or running. It does not include contact sports such as basketball. Taking care of others is also included. Also included is taking care of friends and pets, and the travel associated with those tasks. Although these activities are allowed, it is expected that you are able to maintain social distancing at all times. If you were unable to do social distancing, then that activity is no longer considered essential. Safer at home and essential travel are imperative. According to the CDC, the United States went from 4,226 cases on March 16th to 554,849 on April 14th. That's quite a big jump in less than a month. This brings me to my last point, why COVID-19 is dangerous to everyone. I see a lot of people on Facebook and other social sites talking about how COVID-19 isn't that deadly, or they say the flu kills people every year, why don't we shut down for that? It's easy for people to assume these things without knowing the facts. Let's compare COVID-19 to some of the other diseases. The World Health Organization estimates that the flu kills between 290,000 and 650,000 people annually. The mortality rate for the flu is less than 1%. The Spanish flu that happened in 1918 was an H1N1 virus. It infected 500 million people. That was a third of the world's population at the time. Over 50 million people died from that virus or disease. It had a mortality rate of 2%. The coronavirus has infected about 2,780,094 people globally and has killed 194,664 people. That's between a 3.4 and a 4% mortality rate. These numbers aren't going down and the cases are still rising. So in conclusion, this disease only stops when we stop being selfish. You aren't social distancing, you need to start now. Only leave your house for essential reasons. I know people who are going crazy or worried about their business, but the numbers are still going up, and even with the strict orders we have now. Currently, there is no vaccine, immunity, or cure. If you are experiencing symptoms or think you may have been exposed, self-quarantine, and please wash your hands often. Let's be a part of the solution, not the second wave. We will all get through this together. Stay healthy, everyone.